Hello, everyone, and welcome to our question lab. We're happy to have you here. This evening, we will be discussing virology, and leading tonight's discussion is Dr. Paras Vicaria. And Paras, why don't you introduce yourself?
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then I went back home to do medical school in Michigan. I have worked with USMLE-Rx as an RX coach, working one-on-one with students in regards to the USMLE Step 1 and Step 2 CK, and I'm happy to lead tonight's session on virology.
Excellent. We're happy to have you here as always. You guys are in for a treat. Paras does a wonderful job in these question labs and with his tutees, and we'll talk about our tutoring program here in a minute. We also have some wonderful panelists joining us this evening. If you look at your GoToWebinar control panel, you will see a question box. And we have that there so that you guys can ask questions to our panelists, and they'll do their best to try to answer all of your questions. We have Jeff, who you'll meet later, and Kasia, who you'll meet now. Kasia.
Hi, everybody. My name is Kasia Bornstein. I'm a fourth-year medical student at the University of Miami. And before that, I got a degree in pharmacology from Tulane University. I've been working with Coach RX for the past 8 months or so, mostly with students working towards Step 1 and Step 2, but also working in classroom content as well. It's really something I enjoy to help students understand content, understand their knowledge gaps, and help them achieve their dreams. Thanks, Sean.
Excellent. Thank you, Kasia. We're happy to have you here as well. You have had a chance to meet us. Well, not me yet. My name is Sean. I've been with Scholar RX and RX Coach for about 2 years. And I work with our wonderful coaches like Kasia and Paras and many others. And what we do is we work with students on an individual basis to help them accomplish their dreams and maximize their potential. We'll talk more about that later. You've had a chance to meet us now, and so we'd like to have the opportunity to meet you. So here is a question I'd like for you guys to answer. Who are you? Please take a moment to let us know. We'll give you all a few seconds to submit your responses, and then we'll get started with our first question of the evening on virology. For those of you joining us for the first time, please let us know in the question box if this is the first question live. We'd love to welcome our newcomers. But also, if it is your first time, this is the same poll format that you will see with all 4 questions this evening, where you'll be able to submit your responses before we unveil the correct response and explain all of the answer choices. All right, looks like the answer choices have been submitted. Let's take a look and see where the audience is from this evening. Once again, it looks like we have a heavy international medical student and graduate crowd, US born and Canadian born IMGs, as well as MD, US and Canadian, as well as DO students. So we're happy to have all of you here this evening, and we look forward to a wonderful webinar. One other thing we would like to know is how many additional resources are you using to supplement your learning? How many additional resources outside of your professor's lecture notes are you using to supplement your learning? Please take a moment to let us know. As always, we will have a special offer for all of you in attendance this evening, as well as a raffle. Please remember that you must be present to win, so make sure you stick around until the very end so you have your chance to win that raffle and take advantage of our special offer. All right, we'll give you guys a few more seconds here to respond, and then we'll get started. All right. And it looks like over 1/3 of you are using between 3 and 5 resources. Some are using 10 or more. Some are using between 6 and 9. And 2% of you guys are using 0 other resources. So we'll talk more about resources and how to consolidate resources towards the end of this evening's question lab. I know I mentioned RX Coach, and you met 2 of our wonderful coaches, Paras and Kasia. RX Coach is our one-on-one coaching and tutoring program where we work with students on an individual basis, like I said, to help them identify strengths and weaknesses, maximize their potential by also working on test-taking skills. So we'll talk more about that later, but what I do want you all to know is that we will be employing the RX Coach methodology in all of our questions this evening. As we begin with the first question, you will see that the answer choices are covered up. And that is by design. We always cover up the answer choices as part of our step. as part of our process. And the reason we do that is because we do not want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you might be unfamiliar with, which may cause you to panic as you're trying to answer questions. So I've gone ahead and removed the answer choices for you. After that, we will begin with the lead-in, okay? The lead-in is the last sentence or the question itself. The lead-in in this STEM is, the lead-in for this question is, which of the following viruses is most similar in genetic makeup to the virus causing this patient's current infection? Which of the following viruses is most similar in genetic makeup to the virus causing this patient's current infection? And the reason we read the lead-in first is because we want you to know what they're asking so that when you read the STEM, you can pick up on relevant clues and know what those clues are, and that should help you get the question right, but also it should help you save time. So once we read the lead-in, we like to ask our students how many steps they think this question will require. An example of a one-step question is when they ask you, what is the diagnosis? An example of a two-step question could be where they ask you, what is the treatment for a diagnosis? And an example of a three-step question could be where they ask you, what is the mechanism of action for a treatment for a diagnosis? So with those examples in mind, please let us know in the question box how many steps you think this question will require. We'll give all of you a few seconds here to respond, and we'll get started with the vignette. Wonderful. I see the responses coming in, and Paros will go over how many steps it will require in a moment. Let's read the vignette. A worried mother brings her 3-year-old son to the pediatric clinic. She reports that he has vomited twice since yesterday. The vomitus was non-bloody and non-bilious. She also reports having seen copious amounts of stool in the toilet. She states that there has been a recent outbreak of diarrhea among the children at her son's daycare. The patient is up to date on all vaccinations. His temperature is 37.8 Celsius or 100 Fahrenheit. Pulse is 123 a minute and respirations are 14 a minute. And blood pressure is 100/72. On physical examination, the patient appears quiet and tired. His eyes are sunken and oral mucosa is dry. Auscultation of the abdomen reveals hyperactive bowel sounds. Which of the following viruses is most similar in genetic makeup to the virus causing this patient's current infection? So now that we've read the vignette and the lead-in, please take a moment to start thinking about the important clues and the relevant clues. And with that, I'll hand it off to Paris. Paris.
Thank you, Sean. So we'll go ahead and show you what we thought were the important clues in the vignette, as well as the lead-in. So in that vignette, anytime you have demographic information, that's going to clue you in to the type of case. And this is a pediatric case. It's a 3-year-old boy. His main symptom that they're bringing him in for is vomiting. It's also important to keep in mind as you're going through this vignette, what's important in terms of what we would consider a pertinent positive and a pertinent negative. So sometimes there are things in the vignette that are negative, but it's important to know. So in this case, it's important to know that the vomitus was non-bloody and non-bilious. And that's kind of why we used a different color there, okay? He also, this patient also has stool and diarrhea. There's been an outbreak of diarrhea at the daycare. That's important that the son goes to daycare. It's also important, pertinent negative, that he is up to date on all vaccinations. They gave us some physical exam findings, and that pulse actually may be, relatively normal given his age, but just important to note. He's quiet, tired, and some other physical exam findings that we'll talk about later. Now, in terms of the lead-in, which is that last sentence that Sean mentioned, it's also important to know, to highlight or make note of what words or phrases are most important to getting this question right. So keep in mind what this question is asking for. This question is asking which virus of the following answer choices that we'll show you in a second, which of those viruses is most similar genetically to the virus causing this current infection? So this could actually be, I think this could be maybe a 3 or even a 4-step question. I think 1, we need to know what the diagnosis is. 2, I think you could argue maybe it's the same step, maybe it's a different step. What virus causes that condition? 3, what is the genetic makeup of that virus that causes the infection? And 4, which of the following viruses from the answer choices has the same or most similar genetic makeup to the original virus? So as you can see here, at least a 3-step, maybe a 4-step question. So it's important to break it down like that as well. So let's take a look at those answer choices. And when we go through our answer choices, we like to start at the bottom and work our way up. So I'm going to read from answer choice E and work our way up to A. And the reason we do that is because it ensures that you get through all of the answer choices, that you don't start at A or B and see something you like and then pick that and don't see the rest of the answer choices. This makes sure that you get through all the choices and are able to process them. So we'll go ahead and do that now. Answer choice E, rubella. D, poliovirus. C, parvovirus. B, parainfluenza. And A, influenza. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the correct answer in this question, and we'll talk about it in just a few seconds.
Wonderful. Thank you, Boris. We'll give all of you a few seconds here to respond. I see some of you prematurely started mentioning viruses. Remember, this is not a race. When you're taking this exam, these questions are not meant to be sped through. Take your time, have a system, and try to get it right, because you want to make sure you answer the right question. And you are doing that in a way that's going to help you maximize the amount of questions you get right, and therefore your score on test day. So we'll give all of you a few more seconds to respond. Remember, on test day, there is no penalty for guessing, so you should never leave a question blank. So if you're confused, don't worry, just take your best guess, and Boris will explain the correct and incorrect answer choices here in a moment. All right, I see the responses coming in. A few more seconds here. Wonderful. So it looks like 36% of you picked poliovirus, and in second place, a close second with 33%, was parvovirus. So let's see what the correct answer is. The correct answer is D, poliovirus. So 36% of you got it right. For those of you who did, wonderful, great job. For those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. This is definitely a difficult question with multiple steps. So I apologize that that image is kind of hovering over that lead-in, but I'll make sure to read that out loud for you. So this is a child that's presenting, as we talked about, with the vomiting, diarrhea, and then signs of dehydration. So dry mucosa, sunken eyes. On top of that, with an exposure to a recent outbreak of diarrhea. So this is what you would call gastroenteritis, and it's most suggestive of an infection with norovirus. Due to vaccination efforts against rotavirus, norovirus is now the most common cause of viral gastroenteritis in resource-rich countries like the United States. Before, it used to be rotavirus, but now it's norovirus. So norovirus, that is a member of the Calciviridae family, and it shares the same genetic makeup as poliovirus, as you can see there in that table. It is a positive sense, single-stranded RNA virus that is non-segmented with no envelope, that is non-enveloped, and icosahedral capsid. You know, unfortunately, these are a lot of morphologic characteristics of viruses that are fair game for step one. And it's going to be important to know that, not just DNA or RNA, but the types of sense, whether it's enveloped or not. And this is a question that kind of reflects that. As you can see there, norovirus and poliovirus actually share a very similar genetic makeup. So let's talk about the other answer choices and why those are incorrect. Rubella, well, as you can see there, it's also a positive sense single-stranded RNA virus that is also non-segmented with a icosahedral capsule, just like norovirus, but it is enveloped, as you can see there in that table. So that would make that incorrect, or at least not as good of an answer as poliovirus in the question. answer choice C, parvovirus, which I believe was the second most highly selected answer. This is actually a single-stranded linear DNA virus. So it's a DNA virus, unlike norovirus, which is an RNA virus. So that's incorrect, or at least much more dissimilar. Answer choice B, parainfluenza. This is a paramyxovirus, and as you can see there, it is actually a negative sense RNA virus. So also not as similar to norovirus as poliovirus. And then influenza as well, very similar to parainfluenza, also a negative sense RNA virus that is also enveloped like parainfluenza. So not as similar to norovirus as poliovirus is. So again, the lead-in question was asking which of the following viruses is most similar in genetic makeup to the virus causing the patient's current infection. We've determined that the current infection is norovirus, and that its genetic makeup is as listed in the table, and the most similar one of the answer choices was poliovirus. And so it's important, as we mentioned, to keep all of these things in mind, and this is a good reflection of the type of a classic virology question, excuse me, that you may get on the USMLE Step 1.
Excellent. Thank you, Paras. Great job, everyone. Let's move on to our second question of the evening. Once again, and for those of you just joining us, welcome. And you'll notice that the answer choices are missing. Once again, that is by design. We always cover up the answer choices as part of our methodology at RX Coach. And we do that because we don't want the answer choices to dictate your thought process. We also don't want you to see an answer choice that you're unfamiliar with. That may cause you to panic as you're trying to answer the question. Which of the following, and so once we remove those answer choices, we will read the lead-in. The lead-in is the last sentence. So here we go. Which of the following best describes the characteristic feature of this patient's causal organism? Which of the following best describes the characteristic feature of this patient's causal organism? And with that, I'll give you a few seconds to let us know in the question box how many steps you think this question will require, and then we'll read the STEM itself. All right, I see the responses coming in. Let's read the STEM. A 23-year-old woman comes to the clinic because of pruritic warts on her vagina that appeared 3 days ago. Over the past year, she states she has had multiple sexual partners with inconsistent condom use, and she adds that she began having sex at a young age. Physical examination shows raised, flesh-colored lesions on the mucous surfaces. Shows the presence of coleocytes in the tissues. Which of the following best describes a characteristic feature of this patient's causal organism? I want you all to start thinking about the important clues in the vignette, and with that, I will turn it back to Paras.
Thank you, Sean. So we'll go ahead and show you what we thought were the important clues in the vignette and the lead-in. So in this vignette, again, demographics, this is a 23-year-old woman with itchy warts on her vagina. She's had multiple sexual partners, not been using condoms regularly, and she's been having sex at a young age. And we'll talk about that a little bit later on. Importantly, there are some physical exam findings there of some flesh-colored lesions on the mucosal surface, and then a biopsy showing coilocytic change or coilocytes in the tissue. So that's what we thought were the important clues in that question. And so if you were to ever need to go back and look at that vignette, you can see what are the important things in that without having to read the whole vignette again. Now, when we're talking about the lead-in, the important things that we thought are characteristic feature and causal organism. So they're asking us to figure out what the causal organism is and what is a characteristic feature of that organism. So in terms of how many steps this could be, I think this could maybe be a 3-step question. Again, I think 1, we need to figure out what's going on, what's the diagnosis. 2, what is the organism that causes that diagnosis? And 3, of the following answer choices, what is the characteristic feature? So I think a nice 3-step question here. And again, it's important to keep that in mind because then you can start to think of those when you're going through that vignette. So let's take a look at those answer choices. And again, we will start at the bottom and work our way up so we do not bias ourselves. Answer choice E, smallest DNA virus, only non-enveloped single-stranded linear DNA virus. D, single-stranded negative sense and circular RNA virus. C, non-enveloped double-stranded circular DNA virus. B, double-stranded non-enveloped linear DNA virus. And A, double-stranded enveloped linear DNA virus. So I know a lot of words there, but we're going to go ahead and open up that poll. Select the answer choice you think is the correct answer, and we'll talk about it in just a few seconds.
Wonderful. Thank you, Paris. We'll give all of you a few seconds here to respond, and we'll go over the correct and incorrect answer choices. For those of you just joining us, make sure you stick around until the very end because we do have a raffle with a very valuable prize, but you must be present to win. So make sure you stick around until the end because we would hate for you to win and then not be here to collect your prize, and it's happened a lot. We also have a special offer for everybody that we'll share at the end of tonight's question lab. I see the responses coming in. We'll give all of you a few more seconds here, and then we will uncover and unveil the correct answer choice. This is a challenging question, so a few more seconds is not an issue. All right, let's take a look. And it looks like 41% of you picked C, non-enveloped double-stranded circular DNA virus. And in second place was A, double-stranded enveloped linear DNA virus. So let's take a look and see what the correct answer is. And the correct answer is C, and 41% of you got it right. Non-enveloped double-stranded circular DNA virus. And with that, I will hand it off to Faris. Faris.
Thank you, Sean. So as we talked about, some of those important clues is put this patient at a high risk for sexually transmitted infection. Multiple sexual partners, inconsistent condom use, and then also having sex at a young age, specifically for this infection. So her physical exam findings are concerning for genital warts, flesh-colored lesions on the mucosal surface. Furthermore, the biopsy is showing coilocytic change, which is likely leading to the diagnosis of condyloma for this patient. This is a common sexually transmitted infection caused by the human papilloma virus. So that is the causal organism, human papillomavirus, or HPV. It is a non-enveloped DNA virus from that is also double-stranded and circular, transmitted from skin-to-skin contact. And HPV infection can lead to genital warts, cutaneous warts. It can lead to cervical neoplasia, cervical cancer, and other types of neoplasia as well. So that is the type of the makeup of human papillomavirus. So that is why answer choice C is the correct answer. Let's talk about why the other answer choices are incorrect. Answer choice E, the smallest DNA virus, that is referring again to parvovirus, which is also a single-stranded linear DNA virus. That would present with erythema infectiosum, so the slapped cheek infection. You could have an aplastic crisis if they were to have sickle cell. It can also present in adults and young females, but specifically more with arthritis or arthralgias, and that's not what's going on here, so that's likely incorrect. Answer choice D, that's likely getting at arenaviruses, which are enveloped viruses, and Bunya viruses and Delta virus, and these cause a few different types of more rare infections, specifically some of the encephalitis type infections, which we're not seeing here in this question. So this is also an incorrect answer choice. Answer choice B, that would be getting at something like adenovirus, which is a non-enveloped linear double-stranded DNA virus. It's associated with a few things such as pharyngitis, tonsillitis, pneumonia, conjunctivitis, none of which is going on in this question as well. And lastly, answer choice A, that's getting at something like herpes virus, which is something that you could potentially be mistaken for in this question. Keep in mind, though, that that causes more of a vesicular eruption if you were to have genital herpes. So in this question, it's important, as you can see, again, to know the makeup and the morphology of viral infections, because that was what was going to clue you in that answer choice C was the correct answer for causing HPV.
Wonderful. Thank you, Paras. Great job, everyone. Before we move on, I would like to ask you a question. And the question is, how would you describe the results you are seeing after your study sessions? So we'll give all of you a few seconds to respond. Be honest and let us know. How would you describe the results you are seeing after your study sessions? I am seeing great results and I am happy. The results do not match my efforts. I am plateauing. I am spending too much time and falling behind. Don't worry, the responses are anonymous. We'll give all of you a few seconds here. All right, I see the responses are coming in slowly for this one. We'll give all of you a few more seconds here. This is the easiest question of the night, right? All right. And once again, you know, a majority of you are not too pleased with your results, but that's okay, because as you can see, you're not alone. A lot of people are saying the results do not match their efforts. I'm plateauing. I am spending too much time or falling behind. And if you find yourself in any of those categories, or even if you're seeing great results and you're happy and you want to do better, you should consider RX Coach. RX Coach is our new individualized tutoring and coaching program. What we do is we start with a 160 question assessment. Based on that assessment, and we've created that assessment, based on that assessment, we will try to evaluate your strengths and weaknesses and come up with a study plan to put you on a path to success. And then we'll meet with you at regular intervals to answer your questions, go over concepts, but also work on focused question dissections to work on and enhance your test taking skills. As you know, every single person is different. Everybody learns differently. And the advice that your classmates may give you may not be applicable or relevant to you based on the type of learner you are and your individual strengths and weaknesses. So what we do at RX Coach is get to know you as a learner and as a student and as an individual, and then we cater this program directly to you. And we've had a lot of success. We have testimonials available on our website. We had a student go up 76 point, one that went up 35 points. So these are just recent ones. But every single student that has come to us has accomplished their goals and done well on these exams. And I see some students here right now, they came to us for step 1 and they were so happy they came back to us for step 2 tutoring. And so keep that in mind. If you're interested in you know, not leaving anything off the table, you want to make sure that you're doing everything you can to get the best score possible to get the residency you've always dreamed of, then reach out to us at rx-coach.com and set up a free consultation so we can talk about the program and how it can benefit you. If you want generalized study advice and general tips, please visit us at firstaidteam.com. All of our tutoring packages do include access to RX 360 Plus, which includes RX Bricks, which I'll show you later. And you get to work with certified coaches like Paras and Kasha, who you met today. So once again, rx-coach.com, set up that free consultation to talk about the program and how it can benefit you. And make sure you're doing everything you can to get the score that you deserve. And with that, let's move on to our third question of the evening. Once again, the answer choices are covered up. Which of the following additional findings is also likely on examination? So we'll read that lead in again. Which of the following additional findings is also likely on examination? We'll give all of you a few seconds to respond here and let us know how many steps you think this question will require. All right, let's read that vignette. A 17-year-old boy comes to the physician because of fever and pain on both sides of his face, located between his ear and jaw. He finds it difficult to talk, eat, and swallow. He denies headache or neck pain. He has recently returned from an overseas class trip, and one of his classmates had a similar illness a few weeks ago. He has not had routine immunizations. His temperature is 38.8 Celsius or 101.8 Fahrenheit. Pulse is 90 a minute, and blood pressure is 118/72. Physical examination shows swelling and tenderness of the mandibular area bilaterally. Which of the following additional findings is also likely on examination? I want you all to start thinking about the important clues in the vignette as I hand it off to Boris.
Thank you, Sean. So once again, we'll show you what we thought were the important clues in the vignette and the lead-in. So again, demographics, this is a 17-year-old boy who is coming in with fever and pain on both sides of the face. We thought those were important clues that we had highlighted. He also has this going on between his ear and jaw. He's finding it difficult to talk, eat, and swallow. And then furthermore, a pertinent negative here would be that he denies headache or neck pain. Furthermore, he recently returned from an overseas class trip. And then one of his classmates had a similar illness. He has not had routine immunizations, and that's going to be important as we talk about. One important physical exam finding is that temperature. And then, physical exam, another physical exam finding, is a swelling and tenderness of the mandibular area bilaterally. So this question is now asking us, which of the following additional findings is also likely? So I think this could be maybe a two-step question. I think one, we need to figure out what is going on in this patient, what's the diagnosis? And then two, what would be an additional finding that would also likely be seen? So it's going to be a couple steps here. So we'll go ahead and take a look at those answer choices. And once again, we will start at the bottom and work our way up. Answer choice E, splenomegaly. D, peripheral edema. C, hepatomegaly. B, epigastric pain. A, conjunctivitis. So once again, we'll go ahead and open up that poll and then go ahead and select the answer choice you think is the right answer, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. I see a lot of people, rushing to give us a response on what might have caused this. Remember, this is not a race. We want you to take your time, and really the point of these question labs is to work on the process and learn the material. So if you're jumping to an answer choice or trying to beat the clock, you're really doing yourself a disservice. So try to follow the system, and I think you'll find that it'll be very, very helpful and beneficial for you. We actually had a student that came to our question labs and did above a 250 and sent us a very nice email and attributed a lot of that success to the question labs and the help that he got from our RX coaches. We got that email just a few days ago. So we're glad that these question labs are helping, and we'd love to hear from you. If you're having a positive experience with question labs, shoot us an email. Let us know what you think. All right, a few more seconds here for you guys to submit your responses. All right, here we go. Let's see what you selected. It's a close one. In first place with 31% was conjunctivitis, and a close second was splenomegaly with 28% of you picking answer choice E. So let's take a look and see what the correct answer is. And the correct answer is B, epigastric pain, and 26% of you got it right. So a challenging question, but once again, it is a question that you can get right if you have good test taking skills and you have a good foundation of knowledge and content. And even sometimes when you don't know the material as well as you would like for a certain topic, you can use those test taking skills to get to the right answer, and our coaches help you with that also. So with that, I'll turn it back over to Boris.
Thank you, Sean. Yeah, definitely a tough question. A great job here. And I'm liking what I'm seeing from your answer choices. So here, what we have is a case of the mumps virus. And as you can see here from this table that Sean has included, some of the main symptoms, most importantly, is parotitis, or inflammation of the parotid glands, which are situated where this patient was having his symptoms. You can also have orchitis, which is inflammation of the testes in males. You can have meningitis, And then specifically related to this question is pancreatitis. The mumps virus can cause or lead to pancreatitis. So now knowing this, let's go back and take a look at our vignette. So this was a patient who has had a recent sick contact. The patient was presenting with fever and then painful areas on the face between his ears and jaws where the parotid gland sits, as you can see there in that image. They were bilaterally tender and they were swollen, and it suggests a diagnosis of parotitis. And then furthermore, because we know this patient is not vaccinated, the most likely diagnosis is mumps. And some of you may have gotten to that point, but then weren't sure what else you could see with the mumps virus. So we'll go ahead and advance to the next slide. And I believe we still have what we have highlighted. So as you can see there, a lot of the highlighted things is what is going to help clue you into this question. So mumps is caused by an RNA paramyxovirus that replicates in the upper respiratory tract. It's transmitted via respiratory droplets. And as we mentioned, it can cause pancreatitis. And pancreatitis often presents with acute epigastric pain that can radiate to the back. And it's due to autodigestion of the pancreas by pancreatic enzymes. So in this question, I hope you can see now why epigastric pain could be an additional finding indicating pancreatitis in a patient who has the mumps virus. So let's talk about the other answer choices and some that were also highly selected in this question. Answer choice E, splenomegaly. So some infectious causes of splenomegaly include mono or infectious mononucleosis, viral hepatitis, cytomegalovirus, but this patient doesn't have a sore throat, no lymphadenopathy, nothing suggesting liver disease. So these are likely an incorrect answer choice. Answer choice D, peripheral edema. Some causes of that could include filariasis or viral myocarditis. Again, nothing suggesting a filariasis infection or any issues with the heart here. Answer choice C, hepatomegaly. Very similar to answer choice E, infectious mononucleosis, viral hepatitis, cytomegalovirus. But again, this patient doesn't have sore throat or lymphadenopathy, no issues with the liver or jaundice, so likely not a correct answer here. And then lastly, A, conjunctivitis. This could be due to an allergic response, a bacterial infection, viral infection with measles or adenovirus. But again, we're not seeing a lot of the things that you would see with measles, and then also adenovirus as well, which is more of what we classically refer to as pink eye. So the correct answer here is B, epigastric pain, and it's important, as you can tell, to know really all of the potential clinical manifestations of a diagnosis such as mumps, not just that it causes parotitis or orchitis, but also that it causes pancreatitis. And that's really what was going to clue you in that answer choice B was the correct answer here.
Excellent. Thank you, Paris. Challenging question, but you will have challenging questions on your exam. So it's important that you have a good foundation and you are employing good test taking skills. And once again, you can visit us at rx-coach.com and schedule a free consultation to talk about the program if you're interested in receiving that one-on-one attention. We have one question less this evening. Let's try to finish strong, and then we'll have our raffle and our special offer. So here we go with our last question of the evening. The answer choices are covered up, and we will begin with the lead-in. Which of the following is associated with the most likely causative organism? Which of the following is associated with the most likely causative organism? And we'll give you a few seconds to let us know how many steps you think this question will require. And let's read that vignette. A 46-year-old woman is brought to the emergency department because she has had difficulty catching her breath. The patient says that she's been feeling warm and lethargic for the past 2 days and has not been able to eat because of nausea and vomiting. She also reports having a dry, non-productive cough. Medical history is significant for receiving a bone marrow transplant 2 months ago. Temperature is 39.4 Celsius or 103 Fahrenheit. Blood pressure is 100/74. Pulse is 88. Respiratory rate is 26. And oxygen saturation is 92% on room air. A chest X-ray shows bilateral, symmetrical lower lobe peri-bronchovascular and alveolar processes. Bronchoalveolar lavage is performed and the results are shown. I'll give you all a few seconds to take a look at that image. And then we'll read the lead in again. Which of the following is associated with the most likely causative organism? And with that, I'll hand it off to Paris.
Thank you, Sean. So once again, we'll go ahead and show you what we thought were the important clues in the vignette and the lead-in. So again, demographic, so 46-year-old woman who has had issues catching her breath. She's felt warm and lethargic, and they later told us that she did have a fever of 103. She also has a non-productive cough. And I think one of the most important things here in this vignette is that she had a bone marrow transplant 2 months ago. She's got a low oxygen saturation, and there are some specific chest X-ray findings that we'll talk about later, as well as a bronchoalveolar lavage, and the results in that picture below that we'll talk about as well. So this lead-in is asking us again, and we've kind of highlighted what we think are the important clues in that lead-in. Which thing is associated with the most likely causative organism? So again, we are making note here that they're asking us about the causative organism and what could be associated with that. So again, this is probably a 3-step question, 2 to 3-step question. I think 1, we need to figure out what's going on, what's the diagnosis. 2, what is the causative organism? And then 3, what is associated with that causative organism? So we'll go ahead and show you guys the answer choices, and we will start again at the bottom and work our way up. Answer choice E, ring enhancing lesions on MRI. D, non-enveloped and double-stranded linear DNA. C, latent in mononuclear cells. B, Langerhans giant cells. And A, drug of choice is fluconazole. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the right answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So this is our last question of the evening before we do the raffle and our special offer. So let's try to finish strong. We'll give you all a few seconds here to respond and let us know what you think the correct answer is. I saw a comment from our student I mentioned earlier who attributed a lot of his success on step 1 to these question labs and attended last night's step 2 question lab. Keep in mind that, we love doing these, and the more people we get, the, maybe we'll do them more often or less often as we reevaluate how often to do these. So please tell your friends about the question lab. We'd love to see more people come so we can help as many people as possible. All right. I'll give all of you a few more seconds here. I see the answer choices coming in, but it's a tough question, so a few more seconds, not an issue. For those of you asking, next question lab's topic will be reproductive pharmacology. Reproductive pharmacology. Let's see what all of you selected. And 43% of you selected C, latent in mononuclear cells, and in second place with 22% was Langerhans giant cells. Let's see what the correct answer is. And the correct answer is C, latent in mononuclear cells, and 43% of you guys got it right. So well done to those of you who got it right. For those of you who didn't, don't worry. Paris is going to explain this to you now.
Thank you, Sean. And on the next page, we actually, Sean has pulled up a nice table here of the causative organism, which, as many of you guys had selected, is cytomegalovirus, or CMV. Now, as you can see there in that middle column there, the one thing that you really want to keep an eye out for is pneumonia in transplant patients, okay? And that's actually what this patient was. This was a bone marrow transplant patient who was developing cough and then some chest x-ray findings. So as you can see there in that middle column, especially pneumonia in transplant patients. It's also to keep in mind that CMV can cause esophagitis and can cause retinitis as well. And the important thing is, when you look at it on pathology, you can sometimes see these owl-eye intranuclear inclusions. And that's what they were getting at with the bronchoalveolar lavage as well. It is, and they, as you guys had selected, latent in mononuclear cells. And that is why that was the correct answer. So let's go back to our question and take a look at that vignette and see, now that we know that, just how those clues starting to fit in. So she had a fever, she was having a cough, she had a bone marrow transplant 2 months ago. On top of that, as you can see there in that image, kind of close to the center of that image, you can see a nice large cell with like a intranuclear inclusion right there, and Sean's drawing an arrow to that right there, so perfect. So this is getting at, again, pneumonitis or pneumonia caused by cytomegalovirus, and it is a common complication in immunocompromised patients, especially transplant and bone marrow transplant patients. So that's what's going on here in this question, and it typically occurs 1 to 4 months after the transplant. What you would see on radiography, like a chest x-ray, is you could see bilateral symmetrical peribronchovascular inflammation. So, and that's kind of what they mentioned in this question as well. So when we're talking about CMV, we've now determined that's the likely causative organism. It's latent in mononuclear cells, as we had highlighted in that table. And furthermore, it is an enveloped double-stranded linear DNA virus. So as you can see there, answer choice D says non-enveloped, but CMV is actually enveloped. Let's talk about some of the other answer choices as well and why that is incorrect. So E, ring-enhancing lesions on MRI. This would be suggesting Toxoplasma gondii, where you can get brain abscesses and multiple ring-enhancing lesions on MRI. So this patient is immunocompromised because of that bone marrow transplant and possible immunosuppressive medications. However, we don't really have anything that wouldn't really involve the respiratory tract. So that's not a great answer here. Answer choice D, that's getting at something like adenovirus, and really you may have selected this if you thought CMV was non-enveloped, but in fact, as mentioned, it is an enveloped virus. Answer choice B, Langerhans giant cells. These are macrophages that have fused together, and you can sometimes see this in mycobacterial infections such as tuberculosis, which can occur in immunocompromised patients. However, you often may have hemoptysis, which we don't have here. And remember, with TB, you often have involvement of the apical lobe of the lung, not the lower lobes as was involved here. And bilaterally symmetrical, that wouldn't fit with TB as well. So this is not a great answer choice, but I can see why some of you chose that. Answer choice A, drug of choice is fluconazole. This could be getting at a candida infection. So again, you would use azoles such as fluconazole to treat candidal infections, and maybe this patient is having a candidal infection. But remember, what we would see with candida is we would see pseudohyphae and budding cells, which is not what we're seeing here in this question. So it's important, as you can see there, we had a lot of different answer choices, all of different types of different types. One of them was talking about the treatment, one of them was talking about what you'd see on imaging, one was the morphology of the virus. So it's important to know that everything really is fair game, and these multi-step questions can be quite difficult, but repetition and focusing on the material, as Sean has mentioned, will really help clue you in to what's going on and hopefully be able to get you to the right answer as well.
Wonderful, thank you, Paras. We have a student asking, how can we avoid changing our answers? And the thing is, that is a very common test taking mistake that students make. But the thing is, there isn't one reason why students do it. It's different for, there's various reasons, and it's different from student to student. And so the best way for us to answer that question is to really, suggest getting a coach, because those are the types of test taking skills that we teach you and help you employ as you are studying and preparing for your board exam. So, the general advice there would be, be confident, stick to your answer choice. But, if you want more specific details to figure out why you're changing answer choices, we can see if there's a pattern between easy, medium, hard questions, or 1, 2, 3-step questions of certain subjects, then we can pinpoint and diagnose why you're changing it, and our coaches can help you with that. So I hope the answer choice helps. One thing I do want to share with you, we talked earlier, and I think about 2/3 of you were using more than 3 to 5 resources while you were studying and preparing for your in-school exam or your board. So one thing you should definitely take a look at, and Jeff will show you that we have some free bricks available also, is RX bricks. And here is a brick on cytomegalovirus, which we just covered. And as you can see here, we have our learning objectives very clearly laid out, and a nice case connection here to really bring that material to life so you have something to relate it to, right? And we talk about the virus. We have little flashcards here to help you hone in on that information and practice it. We ask you important clues that'll help you retain this information while you practice it. We have clinical correlations, once again, to bring that material to life, give you real world examples of how and when you might see this in practice. We have wonderful images, as you can see. And as you continue in this learning module that we call all RX bricks, you will get to the bottom. I'll scroll through it here quickly. And we'll connect back to the original case connection to bring that material back around to make sure you are able to get that information and retain it. Then we have a summary of what you should be able to take away after you look at this brick. And we have practice questions to ensure that you are able to not only learn it, but apply it. We have explanations here. And then at the end, for those of you using so many resources, you can, first of all, you can mark off these objectives to make sure you got them. If you didn't, you can leave it blank. But if you want to consolidate resources and you're tired of flipping back and forth between different things and trying to find the same topic in different resources, and then you're trying to see, hey, did I learn it? Where can I find it in first aid? Can I do practice questions on it? Can I watch a video on it? Where can I get more flashcards on it? Well, Brick solves that problem for you in our Go Deeper section. You can find these topics directly in first aid. You can study these topics with flash facts. You can watch express videos if you want further explanations. And then if you really want to make sure you can apply what you've learned with board style questions, you can practice with QMax.